My name's Abby and this is Jacob. Do you consent to being in this video?
Yes.
This is a male, 27-year-old male who lives a relatively active lifestyle. Today we're going to be doing two different body composition assessments. The first being the waist to hip ratio test and the second being the 7-site skin fold measurement test. The purpose of these tests is to evaluate body fat distribution and overall body composition. First, we'll start with the waist to hip ratio test. This test helps assess the distribution of body fat, which is an important indicator of health risks related to obesity, such as cardiovascular disease. Is it okay if I measure your waist and your hips?
Yes.
Okay, so first I'm gonna measure his waist, which is between his last rib and his pelvic bone. Approximately 1 inch above the belly button. Which is 86 centimeters. Now, I'll measure the hip circumference, which is around his hips at the largest part of his buttocks. Which is 97 centimeters. I'm going to do it one more time, just to be sure. So, the waist to hip ratio is calculated by dividing the waist by the hip, which equals 87 divided by 97, which comes out to be 0.89. At each site, I will be pinching the skin and underlaying fat away from the muscle and measuring with the clippers. I will measure 2 or 3 times just to double check and make sure that the measurements are accurate. I'll also rotate the order of sites to give the skin time to recover in between measurements. 7-site skin fold test. We're going to start with the triceps. We're going to be doing the posterior midline of the upper arm, halfway between the acromion and the elbow. (10 millimeters). Now we're going to be doing the chest, which is in midline, halfway between the fold of the armpit and the nipple. This is 8 millimeters. Now we're going to be doing the mid-auxiliary, which is the level of the xiphoid process of the sternum. Which is 14 millimeters. And now we're going to be doing the subscapular, which is 1 to 2 centimeters below the inferior angle of the scapula. (14 millimeters). Now I'm going to be doing the suprailiac, which is superior to the iliac crest. This one is 16 millimeters. Next, we're going to be doing the abdominal, which is 2 centimeters to the right side of the umbilicus or the belly button. This one is 16 millimeters. Lastly, we're going to be doing the thigh, which is on the anterior midline of the upper leg. This one was 10 millimeters. I'm now going to do each site 2 more times just to be sure. Here are the results for the 2 body fat distribution tests. The waist to hip ratio equation equaled to 0.89, which under 0.090 is low risk category. For the skin fold test, his triceps were 10 millimeters, his chest was 8 millimeters, mid auxiliary was 14 millimeters, subscapular 14 millimeters, suprailiac 16 millimeters, abdominal 16 millimeters, and your thigh was 10 millimeters. Adding all of those up equals 88 millimeters. Using the Jackson and Palak formula, you have around 12.4% body fat. So with your waist to hip ratio, you're in the low risk category for cardiovascular disease, which suggests healthy fat distribution. Your body fat percentage is around 12.4%, which is considered a healthy range for adult males. I recommend continuing to strength and cardio train, maintain a healthy, balanced, and protein-rich diet. Track your progress every 2 to 3 months, and I encourage you to keep drinking your water and getting good sleeps at night.